Since being approved in the UK in the 1960s, nearly 9 million people across the country are now being prescribed antidepressants.
While exactly how they work still isn't fully understood, they are thought to increase serotonin, which helps improve your mood. However, psychiatrist Dr. Joanna Moncrieff claims her research shows that the idea of a chemical imbalance is a myth and that they may only work as a placebo.
Here to challenge those controversial claims is Professor Sir Simon Wessely, who says antidepressants are effective and should be prescribed to those who need them. Good morning to you both.
Morning,
Good morning, Simon. Good morning. Can we first of all start off by saying what exactly are antidepressants? Because when I was reading the brief, I can't believe that actually scientifically we don't quite understand how they work.
We don't understand very much about how they work at all.
Right.
And the name antidepressants is a misnomer, because what we don't know that they actually work by targeting an underlying brain mechanism that's related to depression, because there's no evidence that there is no convincing evidence or consistent evidence of a brain mechanism that relates to depression that could explain the action of antidepressants. And because so few people are aware of that, was why I decided to write my new book, Chemically Imbalanced, which is out now, which explains to people that that antidepressants don't work in this way, but they are active drugs. They do change our normal brain chemistry and normal brain activity, and by doing that, they change our mental states in one way or another, just like having a drink of alcohol would change your mental states. Now, that may affect people's underlying feelings. One of the effects that antidepressants have is they numb emotions. People consistently report this effect. And of course, that may reduce the intensity of people's feelings of depression. It also reduces, feelings of joy and happiness as well. But that's a very different prospect from taking something that is correcting an underlying abnormality or serotonin imbalance.
Right.
And so, I think that's something that people really need to know about. And then there's also the research that supposedly shows that antidepressants are better than placebo doesn't actually show that they're very different from placebo in the first place.
Okay, let's ask Simon about that. Simon, you've just been listening to Joanna with her response. And you sort of laughed initially. What's your reaction?
Well, I mean, I've known Jo for 30 years, and there's a lot I agree with. That we would agree that depression's important. We'd agree it doesn't have one cause, and we'd agree that it doesn't have one treatment. But I think she goes a little bit too far to completely eliminate the possibility that there might be things going on in our brain that has some relationship to depression. She says that the drugs, antidepressants, change normal brain chemistry. This is it necessarily a totally bad thing. Depression changes brain chemistry as well. So there's no underlying impossibility that certain treatments like drugs might have an effect on depression. That's quite probable. Indeed, I'll argue that we know that they do. But it is certainly the case we don't really know how they work. That's not a secret. Some of the old ideas, which really are very old now, back to when you and I were at medical school, Jo, aren't really now followed by most people. We think they were too simplistic and that things are much more, as they say, complicated than that. That's true. But if you look on the website of NHS England, where I'm sitting at the moment, the first thing it says about antidepressants is that we don't know how they work, which is correct. But the second thing it says later on, we do know they can be effective, which is also correct.
Yes, because Joanna brought up the placebo and the fact that there wasn't much differentiation between the two. But you're saying that actually there is scientific proof that that antidepressants do work.
Is that to address to me? Sorry.
Yes, sorry, Simon. Yes, I'm turning to you.
Okay, fine. I'm freezing to death in the basement of NHS England.
Sorry, Simon.
We can tell the public we're not spending any money and wasting money in NHS. Yes. Jo says that they're a placebo, and obviously there is a placebo effect, quite important, and doctors would be in real trouble if we didn't have placebos anywhere. But the evidence that they're more than a placebo, I have to say now, over all these years, is extremely compelling. We've done thousands of trials, I guess. I'm not sure how many, but lots and lots and lots. And the truth is that sometimes the kind of placebo, as we call it, is much the same as depression. That was in the studies we looked at years ago, Joe, as I'm sure you remember. But there isn't a single study that shows that antidepressants are worse than placebo. There just isn't. And if they were all placebos, you would have tens of thousands of studies showing that as well. So they are modestly effective. We know they've been around a long time. We know a lot about their side effects. They're certainly much safer than they used to be.
Yeah.
If I got depressed, I would certainly want an antidepressant, and I would want other things as well. I wouldn't just want one thing.
Right.
But one of the would think about would be to take an antidepressant.
So, Joe, from your perspective, I'm calling you Joe now. Apologies.
No,
It's
no,
because
it's fine.
I'm calling you Joanna. Your real concern is the overprescribing of antidepressants. You don't believe necessarily that because we don't know what they do, and you think that actually it's a placebo. The overprescribing is the big issue.
I think we should be concerned that so many antidepressants are prescribed, but my real concern is that people understand what they're doing when they take them, and that people are not led astray into thinking that we know that these drugs are that they've got some chemical imbalance, and that these drugs are targeting this underlying imbalance, because I think that does change the sort of decisions that people might make. You know, if you are aware that what you're taking is a drug that we don't understand what it's doing, but it's messing with your brain chemistry in some way,
Patients very rarely
you
are
would
given
naturally be a bit worried
antidepressants
about
without
it.
having them explained by their doctor and whoever's sort of giving that prescription of what it's going to be, surely.
Well, we know that people have frequently been told that they have a chemical imbalance and that the drugs are going to put that right. So that was misleading information that people were given. And nowadays, I expect people are told that, that antidepressants are, have been shown in clinical trials to be effective. So that's not as dishonest, but it isn't conveying the fact that these are drugs that, affect your brain and will affect your mental states in some way.
So what do you think should be being given instead of these antidepressants then, Joanna?
So I think we need to think about depression differently and get away from this idea that it's a medical condition that people have that's the same in each person. I think depression is by and large a reaction to circumstances that are upsetting or threatening or stressful in some way. So we need to help each individual to address the circumstances that have led them to be depressed. And then there are some general things that have been shown to be helpful as well, such as exercise, which is shown to be better than antidepressants in some studies. And therapy obviously can be helpful for some people. Mindfulness is another one that's been shown to.
We've got about a minute left, Simon. All of those things we know make a difference, don't we? Exercise, therapy, mindfulness. What's your reaction that actually what Joanna's trying to say is that's the sort of thing that should be given rather than the antidepressants?
No problems with any of that. And if I could wave a magic wand, two things I would do would be to end bullying in schools and give more people jobs to reduce depression. But as I said, it isn't just one thing, and I don't have any problem in also thinking that there is a role for drugs that you say mess with the brain. But there are plenty of things that we sometimes want to do that for, and lots of other disorders that create depression and other illnesses, where there are things are not working well. Sometimes this other treatment, that may be how it works. But what is not in doubt, and I just can't emphasize it too much, is that they do add to the treatment of depression. Hundreds of thousands of people have been successfully treated with that. What NICE guidelines say, it's what the NHS say, and what's the vast majority of professionals say is that they also help and can help for a very long time.
Okay, thank you very much, Simon.
I'm sorry we don't have more time, but thank you both. It's a fascinating subject.
Thank you, Joanna, too. You
should always consult a healthcare professional before you adjust any medication.
And if you've been affected by anything discussed today, you can visit our app to find the right support helpline.
Right, let's find out what the loose women are talking about. Hi, Chris.